Hi, I'm Melissa Salcedo, and I'm an occupational therapy student at Touro University, Nevada. So today I'm going to be discussing an art therapy intervention for symptoms of post-traumatic stress, depression, and anxiety among Syrian refugee children. This was a Level 3 study that was done in 2016 by Uğurlu, Aka, and Akerturk. So according to the researchers, refugees are among the population of individuals that are at high risk of developing PTSD and other symptoms of trauma, such as depression, anxiety, low self-esteem, and low self-efficacy. They're also at high risk of developing behavioral issues, such as poor self-regulation, poor communication skills, difficulty building relationships with others, and issues in their work or school performance. So this is all due to experiencing traumatic events such as political violence, acts of war, natural disasters, or sexual or domestic abuse. So the aim of this research study was to determine the prevalence of psychological symptoms in refugee children, and also to examine whether or not art therapy is effective in reducing those symptoms. The children who participated in this study were refugees of political violence who relocated from Syria to a small district in Istanbul, Turkey called Sultanbeyli. As of 2016, there were 1,490,034 Syrian refugee children who were reported to be living in Turkey. So for the study, they sampled 63 Syrian refugee children between 7 to 12 years old who were living in Istanbul. 34 of the participants were male and 29 of them were female. And overall, 92% of them reported that they had experienced trauma due to the war going on in Syria. So the intervention that the children participated in was a 5-day arts workshop called Skills for Psychological Recovery. It was delivered by 3 licensed art therapists, and it included 3 main components, which were visual art therapy, dance movement therapy, and music therapy. The visual art sessions focused on themes such as expressing thoughts and feelings, reducing stress, improving self-confidence, and encouraging creativity. The dance movement sessions focused on themes such as increasing self-awareness, relaxation, setting boundaries, and developing healthy social interactions. And then lastly, the music sessions focused on themes such as improving motor skills, distractions from pain, and encouraging teamwork. So the researchers administered pre-test before the workshop and post-test after the workshop using 4 measures. So the first is the stressful life events, which assess the children's stressful and traumatic experiences. The child depression inventory measured the children's depression symptoms. The State Trait Anxiety Scale evaluated the children's general symptoms of anxiety. And then lastly, the UCLA Post-Traumatic Stress Disorder determined if there were any possible reactions to stressful events that the children had experienced. So the results showed that 60% of the children were at high risk of developing PTSD. 23% of them already had PTSD symptoms, and 17% of them had severe depressive symptoms. The differences between pre-test and post-test scores for depression and trait anxiety were statistically significant, and the differences between the scores for general anxiety were not statistically significant. But overall, the scores showed that the children's trauma, depression, and trait anxiety symptoms were all significantly reduced at the post-assessment, which suggests that art is effective in reducing these symptoms among refugee children. So why is this important, and what are the benefits of the study? So for clinical use, art activities are interventions that occupational therapists can use when treating diverse groups of people during their post-trauma recovery. For one, they don't require much space or equipment. They can help individuals express their thoughts and feelings in a safe manner and in a safe place. And they also help to foster occupational engagement in social participation, leisure, and play. And then lastly, they're culturally sensitive, so they can help to circumvent any language or communication barriers that may exist.